why empower them to actually run another insurance plan similar to Medicare? Now, coming from a person who's actually accepted Medicare, I think Medicare is a very well-run plan. It's the private payers that are the real issue, and I think if we have to move in the direction closer to Medicare, because I think a lot of the payers actually mark themselves against Medicare in a lot of ways. But there's no portability of healthcare, and I think you're alluding to it in a lot of ways. There's no portability, so you leave your job or lose your job, and you're forced to go on a COBRA plan for a short amount of period of time, like 18 months or so, and then you're stuck. Then you're screwed because you can't have the same insurance that you just had. You're the same person.
Right.
I don't understand why you're tied to your job.
Right.
Well, when you worked for GE for 35 or 40 years, and everyone stayed at the same job, that's a different story. Now people leave their jobs on a yearly basis at this point. Why can't we keep the same insurance plan? You're the same person. So portability is an issue.
I think the timing, I won't say it's bad, but I think the economy being on the forefront of everybody's minds right now. You have people out there, they call it teabaggers and everything. I'm going to laugh, sorry. But, it's being, a lot of them I think are being run by, liberal people do the same thing, but they're run by people like Dick Armey and who have kind of capitalized on the whole, you can't tax people during a recession. And this is a bad recession. It's hard to get a job. It's hard to pay the bills. Credit companies are clamped down on people.
Well, and I'm also hearing these commercials, and I've only heard them since I've been up in New York, but I don't know if they're running in other states, but the tax on fruit drinks and sodas, that people are upset about this new tax, where in the long run it's actually a good thing, I think, because it's the fruit drinks, not fruit.
Like a tobacco tax.
Syntax, basically the same thing,
It's
right?
the soda tax.
But why is there not better information out there that in the long run, you're not going to get, adult onset diabetes, not, I don't know what yours is, but a lot of it's caused by, as in adult onset, is your food intake, correct? Sugar and
Type 2 diabetes.
There's a strong genetic component.
Right.
And I know plenty of type 2s who aren't overweight, who, did everything right and still
But
developed
people
it
who are
because they're
consuming
insulin
unhealthy products generally are going to get either.
Yeah, that
socially
increases
determined
the risk.
diseases that we can incentivize you. And companies do that, right? They will give you a supplement or take away a salary, whatever it is, if you stop smoking, if you maintain a healthy
That's
weight.
very new, right?
Yes, it is.
That's very new.
Yeah, because corporate America knows that they have to do something to control cost. If the insurance companies aren't going to do it, the government's going to do it. These little worlds of corporations are doing it.
I think it's the culture too. I don't know. I've had arguments whether we're a country that's strong on empathy and compassion or not. And I think we have a long way to go, in that direction. So where you're not going to take my taxes to help pay for care for them. Okay, can you put yourself in their shoes? That's empathy.
Well, but I always try to look at trash cleanup when people make that argument to me. Like, okay, well, I'm going to pay some taxes to have my trash picked up, but also for my neighbors and the people down the street, so there's not trash all over my block. And I don't understand why people don't look at it in that.
There's also scare tactics and
You can answer that?
I can. I think that it's a political question you're asking, not a question about people's understanding of medicine or how government works. It's a question about how people understand political arguments that they hear. I think that we are in the beginning of a moment when we have a new kind of political force that's emerging in the form of Barack Obama becoming president or whatever that means. But that's just at the beginning, and it hasn't really taken the form of big ideas yet that everybody knows has in their head. And we're at the tail end of this kind of 40-year cycle, a huge political trend, call it conservatism, call it whatever you want, which was dominated by a huge idea that everybody in the country understands right away, that big government is bad. Everybody knows that. And so all it takes is somebody, even if we disagree with that, we all know that argument, and you could mouth it instantly, everybody knows it. They're bad because they charge too much in taxes, and they waste your money, and everything they work on, they fail at. That's a big political argument that the conservative movement has worked on establishing since the 1960s, and they succeeded. So now, all it takes is people on radio, and newspapers, on television, to stand up and say, oh, healthcare reform, government is bad. And everybody says, oh, I don't want public option because government is bad. And if you actually listen to what people say, that's the thing. That's the crazy thing about the town hall meetings. If you listen to what people said, they said, I love my Medicare. And I don't want a public option because government is bad. And then the Democrats...
Oh, they are bad. The government is terrible at making the
by
problem,
roads.
delivering
Yeah.
healthcare.
But sure, it's terrible.
Yeah.
But the Democrats heard that and they said, oh, people don't understand Medicare, and it was the wrong conclusion.
Yeah.
The Democrats should have heard that and said, everybody's thinking through the conservative movement still. If we want real healthcare reform, we need to take 10 years and we need to establish some ideas about how America should function. One or two big ideas. And we should need to establish them in
When you
elections.
say we, but
on the
who is
state
that within the we? Is that the Democratic Party? Is that a,
Well, it's the Democratic Party, and it's the it's the structure of organizations and interested groups that make something like the Democratic Party succeed. It's people with money. It's people like the Green Family Foundation. it's the pharmaceutical industry. I mean, it is big business down to moms and pops on the corner.
so how would we go forward in creating this dialogue and that where it's not just a dialogue that exists in a vacuum?
Fund a think tank.
Well, but you think about the think
How do you
tanks.
bring change? I mean, can you wait 10 years? I mean, it's something that.
Well, you were
could
saying that
possibly
the healthcare
start.
plan won't even come, even if it
Yeah,
passes, it
that's-
won't happen until 2013.
That's right, a lot of
Right,
Americans
right.
aren't aware of that this is gonna be
There's nothing
another.
they can do